Hello everyone, my name is Aaliyah. I am a nursing student at the U of I. So today I'm just going to be showing you guys how to auscultate the heart. So first I'm going to show you how to use the stethoscope. So what you're going to do is when you put in your stethoscope, you want to make sure that these are pointing forward into your ears. You don't want to put it in backwards because otherwise you won't be able to hear. You want to make sure that these are facing forward towards your ear hole. So you just want to put it like that. And then when you listen to the heart, you want to use this side. So I'm just going to turn it towards that way. And then if you tap on it, you should hear a little dunk dunk in your ear. So when you're auscultating the heart, you're going to be listening to 5 spaces. So when you're auscultating the heart, what you're listening to is for the heart valves closing. So your first one is your aortic valve. So this is going to be in your second right intercostal space. So if you feel for your first rib, and then go down to that second space that you feel, you're going to listen right around there. And then your next valve is going to be your pulmonic valve. So this is going to be in your left intercostal space. So you're just going to move your stethoscope straight across your left second intercostal space. And then your third point is your Erb's point. So this is going to be your left third intercostal space. So if you go down to the space between your second and third rib, you're just going to listen right there. And then your fourth intercostal will be your tricuspid valve closing. And then the last part you're going to listen to is the left fifth intercostal, and this is going to be your mitral valve closing. So you're just going to move that stethoscope down even further and listen to it there. So again, what you're hearing when you're listening to your heart is listen to a patient's heart is their valves closing. And so some abnormalities you might want to listen to for is an irregular heartbeat. It should sound regular, but if you hear skipped heartbeats or something like that, that would be an abnormal sign. But that's pretty much it for auscultating the heart. So some other videos you're going to see is listening to lungs, how to take your blood pressure, and wound care.
Hi, my name is Kayla. I'm a nursing student at UIC at Urbana, Champaign, and today I'm going to be talking about how to assess lung sounds. Lung sounds are often done by nurses, and it takes a while to understand them just because it could be really tricky trying to figure out what you hear. But today we're just going to be talking about some overall basics. So when you first see a patient, you always want to ask them if they have any shortness of breath, do they have asthma, do they have any cough, and you always want to make sure that you know that before time, so in case they have a cough, you make sure they don't try to cough on you, and also to make sure you pace the patient, and in case they have shortness of breath, that means that, they might need a while you're assessing the lung sounds. So some basic lung sounds other than the clear ones that you might hear, so normal, are you hear that deep breath in and out. You could hear the air flowing in between the lungs and just coming out, no obstructions. But some abnormal things you might hear are crackles, they can be fine, medium, or coarse, and they're caused by air flowing by liquid. So fine sounds sound like a popping sounds. Coarse sounds like a gurgling noise, and they can be heard during inspiration, which means like when you breathe in, like, and you might hear this with people who have pneumonia, acute bronchitis, and acute respiratory distress syndrome. Another one is wheezing, so that's like pretty simple, that's just caused by air flowing through restricted. And I always think about this when you with asthma patients, they have a hard time breathing in and out, and also COPD patients. And it's heard during inspiration and expiration, so when they inhale in and out. The next is rhonchi. This is air flowing over thick liquid, so it's almost like crackles, but not exactly. It's actually kind of hard to distinguish. between those two. And you could hear those with COPD, pneumonia, and cystic fibrosis patients. And the last that I think about is friction rub, which is inflammation of the pleural space. The pleural space is the space between your lung and the tissue around it. So this tissue like surrounds your lung to make sure it gets protected, and that inflammation causes like a friction, like a rub, and you might hear like two pieces of leather rubbing together, and yeah, you can hear this in each lung. So next we'll go on to the assessment, the actual using of the stethoscope. So in this assessment, we're going to be using the stethoscope, and the stethoscope actually has two parts. It has the diaphragm, which is like this flat part that you usually see doctors using, and then the bell part, which can actually be moved, which I didn't know. But for this assessment, we're going to be using the diaphragm. So ideally, we want actually no nails. We want to put on gloves when we touch patients, and we also want the patient to not have any clothes like a top, or if they have a gown, we want to make sure that we could actually unpin it right here and actually assess from here. So first we're going to start off with above the clavicles, which is the collarbone, and we're going to be working our way down and to the sides because we want to make sure that we get the lower lobes of the lungs. So we put on the stethoscope, we make sure the stethoscope works, and we just listen on each side. So we want the patient to breathe in and let go. And we just go like that on each side. So it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. 11 and 12, you have to make sure that it's more towards the side because of the lower lobes, like I said. And during each time you go over here, you want to make sure the patient takes a deep breath. But if they have like shortness of breath or they have asthma, this part might be a little difficult for them, so you need to make sure that they have enough time to catch their breath. So yeah, you want to make sure you go in between here and avoid like the breast tissue, or else it's going to be hard to hear. Or another issue is that you might hear heart sounds. So you have to train your ears to make sure that you only listen to the lung sounds. So after you finish the anterior or the front side of the patient, you want to do the back part. So if a patient's lying on the bed or on a chair, you could just ask them to lean forward and you'll do this, and then you'll still do the assessment. So like the anterior part, you still want to do the top first and then just work your way down. So you do 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So during each one of those, you still want the patient to deep breath in and deep breath out. And when you're finished documenting, you could turn. When you finish document, you always want to put what sounds you heard, what kind of sounds you heard, where did you hear those? Was it in the anterior? Was it in the posterior? And if you just don't know what sounds you can hear, you could always ask another nurse, a doctor, and make sure you just document everything you heard, everything you did, because there's a famous saying that if you didn't document it, it didn't happen. But I think that this was a pretty good overall run through it, and thank you for watching.
Hello, my name is Jalissa, and I will be talking about infectious disease control. So infectious diseases are disorders caused by organisms such as bacteria, viruses, fungi, and parasites. They are usually harmless, but in some cases, they are harmful and become diseases. There are 3 components that need to occur for an infection to control. This includes a host, an agent, and the environment. This is also known as the epidemiological triad. The agent is the infection causing the disease, so this would be the bacteria, the fungi, the parasite, or the virus. The host is the target of the disease, such as a human. The environment refers to the factors external to the host that allows for the disease to be transmitted, such as the climate, culture, poverty, and pollution. The modes of transmission can be either direct or indirect. Direct transmission would be transference of an agent from human to human. Examples include touching, kissing, or fecal-oral. Indirect transmission would be transference via an intermediate. Examples include contaminated objects called fomites, or air, food, water, or insects or animals transmitting a disease to a human or another animal. Infectious disease control includes measures taken to prevent and contain the spread of infectious diseases. There are many ways to do this. First being behavioral changes, which we are probably most familiar with. This includes washing your hands and even eating healthy food so you stay healthy. Another measure is vaccines. Vaccines is a biological prevention that provides active, acquired immunity to diseases. Vaccines are the most successful interventions we use to manage infectious disease. Another measure we use to control infectious diseases includes medications. These include antimicrobials, so antivirals and antibiotics. We also use surveillance. Surveillance is the collection, analysis, and interpretation of data related to the occurrence of disease and the health status of a given population. The diseases that are to be reported by law are called notifiable diseases, and many health professionals are trained on this. We also control environments to eradicate diseases. For example, we ensure safer water supplies in certain areas to reduce the spread of waterborne diseases. Diseases are spread very easily, and it is important that we do our part to the best of our ability. You may visit the Center for Disease Control and Prevention website for infection control guidance for specific diseases. Thank you.
When taking someone's blood pressure, you have a blood pressure cuff and you have a pump right here. The first thing you want to do is feel that brachial pulse so you know where to place the blood pressure cuff at. Right here, there's an arrow pointing with the word artery on it so that you know where that pulse is at. So you want to feel that brachial pulse, and with the pump, you have a valve that opens and closes. So right here, I'm going to close that valve and I'm going to pump until I feel this person's pulse stop. So I'm going to look at the blood pressure cuff and I'm going to keep pumping. And in this case, it stopped at 140. So you want to add about, and deflate the cuff. And then you want to add about 20 to 30 to that to repump the cuff. Give the person some time for their arm to relax after deflating the cuff. I'm going to take my stethoscope. I'm going to place it on that pulse that I just felt. And then I'm going to grab the pump. Make sure that the valve is closed right here. Now I'm going to pump to about 160. And very slowly, I'm going to deflate the pump and open that valve. I'm going to listen for the pulse with my stethoscope, and in this case, I heard it at 120. Continue to slowly open the valve until you hear the pulse again. And in this case, I heard it at 60. Therefore, his blood pressure is 120/60.